Good. Okay, all right, so we'll go ahead and get started here. This is Rose Beeson, and Rose is a clinical practicing nurse. She's a professor of nursing and geriatrics, and she's done some talking with us before. She's come to do presentations last year whenever we had these gatherings, so I think you all will really appreciate having her expertise and her knowledge and having her back again. So I'm going to let you take it over, Rose.
All right,
Thank you.
All right, let me see, get a little closer here. Can everyone hear me? Okay. If I start to slow down or lower my voice, please just raise your hand and I will speak up a little louder. Welcome, glad you can come this evening to hear the talk on communicating effectively with somebody who has Alzheimer's disease. To me, it is the most important thing you can learn about when you are interacting with a loved one who has a disease or a friend or a neighbor or whatever. But it is, how do you communicate with somebody who has this disease? And that's what we're going to be touching on this evening. So this is one of a series that they came out with a couple years ago called The Empowered Caregiver. And as I said, to me, it is the most important, followed secondly by responding to dementia-related behaviors. Those two become very important on this journey of interacting with somebody who has Alzheimer's disease. And why aren't we? All of a sudden it won't advance. Oh, there we go. Now it's advancing too much. All right, let's talk about what we're going to cover this evening. We're going to explain how dementia affects communication for the person who has the diagnosis. What does this disease do to somebody in their ability to communicate with you? We're going to describe what's called person-centered approach. And this is the new approach that the Alzheimer's Association has come up with. And it deals with you and your relationship and what you know about the person with the diagnosis. We're going to list strategies to help you communicate. And we're going to identify ways to improve communication. What is communication? Communication is a very broad topic, and it involves the spoken word. It tells us how we tell people about our wants and our needs, how we express that with individuals. It's how we share our thoughts, our feelings, and our ideas, and how we connect to each other. It is made up of, as I said, the spoken words. I'm speaking to you, I'm communicating to you. You're not using words, but you are communicating to me because of all of your nonverbals. So you are letting me know how much you're taking in, if you've zoned out, if you're interested in something, if you think something is funny or sad. All of your nonverbals speak very loudly to me. My words are loud to you, but your nonverbals are very loud to me. And that's very important when you're working with and interacting with somebody with Alzheimer's, because words lose meanings very soon, oftentimes on this journey, and we call it a journey, because Alzheimer's disease can last for years. I do a lot of support groups, and I have individuals, caregivers in the support group that have been caring for their loved ones 1 year, 2 years. I have them 14, 16, 22, and 24 years. So it can last for a long, long time. It's a journey. And as I said, the nonverbals become very important. They're nonverbals to you because you can't understand what they're always trying to express or say to you. And they are looking at your nonverbals as a mean of expressing how you're feeling, not your words, because they lose meaning to them, but your nonverbals, as I said, become so important. So a knowledge check. Which of the following are ways that people communicate? Talking and listening, attitude and tone of voice, facial expressions and body language, and of course the answer is all of the above. Communication comes from our words, our attitudes, and our tone of voice. All those nonverbals. If you start to clench your fist, if your facial expressions become kind of taunt, if you raise your shoulders, if your tone of voice goes up an octave or down an octave, all of that, all those nonverbals are what the person is reading about you. And that's the way you're communicating to them. So you can tell them, you are just driving me nuts today. And as long as you're relaxed and have a smile on your face, they're fine. Because your nonverbals are telling them all is well, even though your words, which have lost meaning to them, is expressing how they really feel that this is really quite a day I'm dealing with. So it's a very important thing to remember when we are working with dementia and communication. So what happens? How does dementia affect communication? How does Alzheimer's disease affect somebody's communication? Alzheimer's and other dementias damage the brain cells. We know the brain cells are called neurons, the nerve cells in the brain. Those are killed off as the disease progresses. You know, when I started with Alzheimer's disease, specializing kind of in that area, volunteered with the Alzheimer's Association way back in, I don't even want to say it, 89. I tell people I was only 12 years old, but I was very young when I think about it. I didn't think I was young at the time, but I was very young. As I said, back then, we used to think that Alzheimer's disease, the brain started to kill off the neurons maybe 2-3 years before symptoms showed. Now we're saying it can be up to 15-20 years. Your brain is losing neurons before anyone even notices any change in what you do in a daily routine. So it's a very slow progression for most people. Some people, it's 3-4 years and they're gone. Other people, as I said, 25-28 years with this disease. So as I said, but it is a killing off, and that damage to the brain cells, the destroying of the brain cells, of course, affects how they're able to do routinely the things that we do every day, like bathing, communicating, eating, food preparation, dressing. We call those activities of daily living that you do every single day, and they start to lose the ability to coordinate and do all of those things because they're losing the neurons. These changes affect memory, they affect thinking, they affect behavior, and of course, communication skills. So they are not as verbal as they once were, and we'll talk about some of the changes that go on in their communication in just a couple minutes. You have to remember that these communication changes are caused by the disease and not the person. If you are caring for a person with Alzheimer's 24/7, it's very easy to sometimes take things personally because sometimes they'll say things that really hurt. And you have to remember it's the disease talking. It is not your loved one or your best friend or your neighbor that you've known for years. It's not them talking. And I often think if they had on their forehead, it's the disease, not me. So every time you look at them, you're reminded it's the disease talking, it's not them talking. And it's hard. You're human. You're going to get hurt sometimes. Or you're going to be so exhausted caring for somebody or so saddened by losing your loved one and the person that they once were that it's going to be hard not to take it personally sometimes. But you have to remember it's not their fault. It's not them doing it intentionally. And as human beings, we're pretty logical. Human beings are fairly logical. Some are very logical, some are sort of logical, a little bit. But most of us have some logical thinking. With Alzheimer's disease, logic goes out the window. There is no rhyme or reason to what goes on with somebody with Alzheimer's. You can say something to them at 6 o'clock in the evening and they laugh and think it's funny. And you can say the exact same thing at 6:15 and they get super mad and just erupt. You've been with them that 15 minutes. Nothing has changed except their reaction. Try to explain that. You can't. There is no logic to this disease. And that's very hard for caregivers to wrap their brains around because, as I said, we're fairly logical people. Human beings are fairly logical. And we try to figure out and put a reason behind something. And with Alzheimer's, oftentimes, most of the time, there is no reason to their reaction or what they're saying or how they say it or why they ask you 100 times in 2 hours, what time is it? There's no logic to that. You can't explain it. It's just the disease. And as I said, the sooner caregivers can understand that and accept it and remember it in those times when you start to get frustrated, the better off you'll be and your loved one or best friend will be as well. So what are some of the communication changes that are often the earliest signs of Alzheimer's? What do we pick up on? Difficulty finding the right words. Now, we do live in an ageist society. So we do tend to blame everything on old age. I'm out with, friends and we all complain about, I can't remember that person's name. We start talking about, it's like, I can't remember. 10 minutes later, it'll shoot through your brain, or maybe it won't shoot through your brain till the next morning. And all of a sudden, Susan, that's her name. And you think, why did I remember it now? That's normal aging. That is not the start of Alzheimer's. We joke about it. You hear people joke. I can remember my mom who had Alzheimer's. I was her primary caregiver. I can remember before she was diagnosed, years before, she used to joke sometimes as she got to be a senior. Oh boy, I think it's starting. I forgot something. We do it all the time, but there's a difference between normal aging and abnormal aging and Alzheimer's, and difficulty finding words and so forth is way beyond occasionally forgetting a name of something or what you go upstairs and what was I look? You go in a room. What was I look? Why did I come in here? What did I want to do? What was I looking for? You go to the refrigerator. What do I need out of the refrigerator? You forget for a minute. That's normal. When you think of all the things that you have stuffed in your brain over 60, 70, 80, 90, 100 years of being alive and filling your brain with things, it's going to take time to sort out and get the channel of what word you're trying to think of. Occasional, normal. Routinely, you might want to start looking into being assessed. Repeating familiar words, phrases, and stories, telling the same thing. You said, we often see a very big rise in assisted living applications and so forth, memory care applications after the holidays, because oftentimes family members who are out of town come in and they spend a few days with their parents or grandparents, and it's like, whoa, I didn't think it was like this. When I talk to them on the phone, they're able to hold it together very well. But when I spend a day or 2 days or 3 or 4 days with them, you start to see the differences, and that maybe they need a little more help in their daily routine, those activities of daily life. Describing an item when they can't think of the word for it. They can't think of wallet, the thing I carry around, it's in my pocket. They can't come up with the word wallet. Oftentimes, they'll make up their own word. They'll call it something you've never heard of before because they know there's a word for it and they can't think of it, so they make one up. And that's what it is. And don't argue with them, because you will never win an argument with somebody with Alzheimer's, ever. That's almost one of the guarantees in life. So don't even go there. You don't argue. You don't try to convince them it's called a wallet when they're calling it some weird name. You're not going to win. They are. Forgetting what they were talking about in the middle of a sentence, they'll start saying something, and all of a sudden they stop, and it's like, sometimes you can cue them with repeating what they started to say. If you see that they're starting to get frustrated, you back off. Change the subject, move on to something else, let it go. But also, when you're communicating with somebody with Alzheimer's, you have to give them time to remember or think. Maybe they'll remember what they were going to say. So give them a little time to think. If you see that it's not coming, then, as I said, offer. You were saying something about when you went to the store the other day, to try to trigger what they were going to say, and then move on if it's starting to frustrate them. Difficulty organizing words in a way that makes sense. They get to the point where they start to kind of babble and they get their own language, and you can't figure out what they're saying or what they're trying to make sense of. And so you don't quiz them. You don't ask them 20 questions. You let them proceed. When they start to get frustrated, you move on. You distract them onto something else so that they don't feel badly about not being able to do it. You want to always treat them with utmost respect. You don't treat them as a toddler. You don't treat them as a child. You treat them as an adult that they are. And so you give them that love and respect that they're entitled to and have earned their whole life. And so you move on and distract them onto another topic. Definitely, if English is not their primary or first language, they will revert, usually somewhere around the middle, at least by the middle to late middle stage. They will revert to their primary, their first language, and they will stay with that, and they will only speak that. Because short-term memory goes first, long-term memory lasts much longer. Sometimes even into late stage, long-term memory, pieces and parts of it can last. But short-term memory, what they had for breakfast an hour later, sometimes it'll get to the point 5-10 minutes later, they can't tell you what they just ate. They can't remember their name. But oftentimes they'll remember things they did as a child. So when you talk to them, the Easter holidays are coming, Passover, Easter and so forth will be coming, you don't talk about what they did last year, but you talk about what they did as a child, or what they did when they were first married, or as a teenager, or at home with their siblings and with their parents. That long-term memory, they can bring and share memories that are very clear to them. Last year, gone. Speaking less often, I noticed this very much with my mom. She used to come over every Sunday night for dinner, and she always, we're with the grandchildren talking about what's new, what's happening, conversing all the time. All of a sudden, I'd notice that, gee, for the last 15 minutes, she didn't say anything. If you directly asked her a question, she would answer. But to initiate conversation on her own, no, she just sat there. And it's like, whoa, that's not my mom. What's going on here? And so you start to think of, as I said, of course, what I was thinking of was what exactly happened was Alzheimer's. And using hand gestures more than speaking, because they can't. As I said, words lose meaning. And that happens pretty early for most individuals. We do have to remember that no two individuals go through this disease identically. So what one person has that you knew had Alzheimer's, or your grandfather or your parent, doesn't mean that your spouse will have the same thing if they get Alzheimer's. No two individuals have it identically. So keep that in mind always. So what is this person-centered approach to communication? It means you use what you know about the person and adjust how you care for them and communicate with them based on their unique abilities and preferences. You know them best. If it is your spouse and you've been married 30, 40, 50, I have caregivers who are 68 years they've been married, in support groups. They know that person pretty darn well after 68 years. So you know them best. And so you know their likes and dislikes. You know what they were interested in. Are they a bird watcher? Do they love flowers? Do they love to be outside? Do they hate to be outside but want to be inside? Do they like working with their hands? Do they like cooking? Do they like to stay clear of the kitchen at all costs? You know the person. And so you rely on that knowledge to get them interested. Oh, look at the bird out the window. Let's go look at it. Look at the flowers. Let's get out and walk through the garden. Let's pick a few flowers and bring them in so we can look at them when we're inside. Because they can't garden anymore doesn't mean they can't do pieces and parts of it if you give them jobs that are within their capabilities and communicate what you need to do. Water the flowers. And always praise the job they did. What a great job. Help me empty the dishwasher. Wow, we did that in record-breaking time. What a team we are. We finished this puzzle. We finished this whatever because we're a team and we'll always be a team together. You want to give them the support that you are with them. You will be by their side. They are not alone, that they are loved and will be not, as I said, all by themselves, which is a fear they get. They get very fearful of the unknown. I can't imagine what it must be like for somebody with Alzheimer's to not recognize the room, not recognize their bed, not recognize their spouse of 68 years, not recognize their children, know their names. Everyone's a stranger. You must feel so lost and so scared. So reassuring them, communicating to them, you are safe, I am with you, and continuing that over and over again. That is what they need to feel secure. Applying the person-centered approach. Treat them with respect and dignity. We've kind of covered that. You know their likes, their dislikes, communication, preferences. Call them by their preferred name. If they have a nickname that you've had for your husband or wife or father or mother or grandpa, call them by that. Avoid talking about the person in front of them. They may not be able to understand exactly what you're saying, but most of the time they can pick up still that they're being talked about. And no one likes that, whether you have Alzheimer's or not. No one likes to be talked about in front of them, in front of the person. So if you're going to have a family conference, if you're going to have a talk that they are not going to participate in, please don't do it in front of them. And don't correct them. Correcting them doesn't work. If they say it's sunny and 80 out today, they got the sunny right, didn't quite make it on the temperature. You don't argue with them. You don't correct them and say, absolutely not. It's a high of 19 today. No. Yeah, boy, it was really warm, wasn't it? You go along with what they're saying. Arguing with them, as I said before, you will not win the argument. All you're going to do is get them upset. And then they're going to start to escalate. And as they escalate, you're going to start to escalate because you're mad. Because they're not listening and they're not accepting what's true. Anyone can see that it's not 80 degrees outside in Dublin today. Anyone can. And you start to get mad, they start to get, and all you do is cause an uproar. What good is that? So you agreed it with them and say, yeah, boy, that sun was hot today. It was a scorcher. And you distract them on to something else. Does it really matter who's right and who's wrong? Does it really matter in the long run whether they think it's 80 out or you agree? Even though you know it's not true, it just doesn't matter. With Alzheimer's disease, you learn to pick your battles, and that is not one of them. Trying to correct them because they're wrong. In their world, it was 80. In your world, it was 19. They cannot come to your world anymore because of the destroying of the neurons in their brain. If you want to communicate with them, if you want to be with them and feel like you're really with your loved one, you have to go to their world, no matter what it is, whether it's 80, 90, 0, it doesn't matter. They can't come to you, but you can go to them. My mother used to, when she first went into memory care, I'd stop after work almost every day to spend some time with her. And she was always so interested. We have 3 children, always interested in the grandkids, what they're doing. So when I'd visit, I'd want to talk about them. All she wanted to talk about was why her father wasn't at breakfast that morning. And I'm like, your father at breakfast? If I told her the truth, well, maybe because he passed away 22 years ago. Maybe that's why he wasn't at breakfast. What good would that have done? She would have just gotten upset. My father's passed away? All upset. So I entered her world. I used to call it Never Never Land. I'm going to Never Never Land. And I used to talk about, well, I bet he went to work early this morning. But I bet he'll be there at dinner. And she'd forget about it by dinner. But then, well, what did you have for breakfast? What did he like to eat? Were your brothers and sisters at breakfast too? And we talk, and that was communicating. What is communication? That's how I felt close to my mom. That's when we were together. Were we talking the truth or reality in my world? Oh my God, no. But we were talking her reality. But we were talking, and we were laughing, and I was with my mom. And that's what's important. She couldn't come to me, but I could go to her. And that's a very important thing to remember about this disease. Now what is happening? So treat them, as I said, with the respect that they deserve. And the last thing here is so important. Validate their feelings. Even though they have Alzheimer's, everyone likes their feelings validated. If you know they're upset, if they say, I lost my wallet, somebody broke into my room and took my wallet, or they took my glasses. Oh my gosh, somebody stole my glasses. Well, you know they just misplaced them. No one broke in and stole their glasses or their wallet. But you validate their feelings. Oh, that would make me so mad. Somebody broke in, and that isn't right. I know you're upset. I'd be upset too. Validate their feelings. When they are mad about, well, somebody, took my lunch. I didn't have lunch today. Well, you know they ate. You saw them eating. You got them out of the lunchroom, and they had just eaten. Somebody stole my lunch. You validate. Boy, I bet you I'd be mad too. Validate their feelings, how they're feeling. That right away, with or without Alzheimer's, starts to de-escalate the situation. Somebody's hearing me. Somebody's listening to me. Somebody believes me. Alzheimer's patients get a lot of no, no, no. No, you can't do this. No, you can't do this. Come here. Don't do that. Don't do this. Sit down. Be quiet. Do this. They get a lot of no's. They want to be heard. And if you validate their feelings, they have been heard. And it goes a long way to creating a good relationship with them and being able to communicate with them. Having a terrible time here, losing my thing. Include the person living with dementia in conversations. Talk directly to the person. I call this eyeball to eyeball. You can't walk into their room, and if they're looking the other way, start talking to them and expect them to know that you're talking to them, even though it's only the two of you in the room. They may not hear you. They don't know that you're talking to them. Eyeball to eyeball. Make sure you have their attention when you talk to them. Speak slowly and clearly. If you have to repeat a question or a statement, make sure you use the same words. And fewer words are better than lots of words. If you need to ask a question, 3 or 4 words, that's it. You don't need 3 questions to get your point across or ask your question. If you repeat the question, use the same 3 or 4 words. If you change the words, they may think you're asking something totally different. And you have to give them time to answer, much longer than when they didn't have Alzheimer's. So if you ask a question, give them time to hear it, get it through their brain, and get a reply out of their mouth. Don't think it's going to come really quickly like it used to. It's not with Alzheimer's. Acknowledge what the person says. Oftentimes kind of repeating or rephrasing what they said helps them to understand. Keep them involved with the conversations. I said that, earlier, my mom got real quiet. So I had to, bring her into the conversations, ask her a direct question so she would partake at our family meals. And talk about, her past. Talk about, as I said, at breakfast, what did your brothers and sisters eat? What was your favorite breakfast meal? What did you like to eat for breakfast when you were a child? it comes time when she won't be there to answer those questions. So ask the questions, ask the long-term memory things, and learn about their past and so forth while you can. Be patient. As I said, give them time to decide. Don't interrupt them. Try not to speak for them because they're slow in getting out a statement. Middle stage, they really do need to socialize. So keeping up with friends, not necessarily big parties. Oftentimes holidays come and oh my gosh, the family gathers and there's 25, 30 people and they've been doing this for 30, 40 years and it's great. Well, this year it wasn't so great. They went and 5 minutes later they wanted to go home. I'm going, let's go, I want to go. I want to go home, I want to go home. They want out of there. Why? Because it was overwhelming for them, overstimulated. Too many conversations going on, too many people talking, too much noise. They didn't know if they were talking to them or somebody else. It was too much. They started to feel unsafe. And so they wanted to go home where they felt safe. Oftentimes, it's not to the home they just left, but where they want to really go is their childhood home. That long-term memory, they want to go back to their childhood home. We frequently hear, I want to go home, I want to go home. And telling them you are home isn't going to work because they're not home. They don't believe they're home. And you're not going to convince them they are home. So you say, well, what do yeah, I think that's when my mom went to her first assisted living apartment, she loved it. And when she was in memory care, she would start to say, I want to go back to that apartment. I didn't tell her, no, you can't, because you need a locked unit because you wander and you can leave the facility and it's dangerous. She wouldn't understand. She'd say, you're crazy. I wouldn't do that. So I answered her by saying, what a great idea. I love that place too. But there's a waiting list. But when I get home, I'm going to call and get your name on the waiting list. And as soon as an apartment comes up, we're going to move that place. What did you like about it? And then we talk about how great that apartment was, what I liked, what she liked about it. And we were communicating and we were together. Would it ever happen? No. Was it hard to lie to my mom? Yes. We don't call it lying. We call it therapeutic fibbing. There's so many terms we use. I have a caregiver in one of my support groups. She calls it fiblets. I told my husband a whopper yesterday, a fiblet out of sight, she'll say. It's hard, from this high, I was taught never lie to my parents. And now I'm telling her, oh, sure, you're going to go back to that apartment. But what good would it do to upset her with the truth? And here we were able to talk and reminisce about how great that apartment, and it was nice. It was such a nice place. And I wish she could have gone back, but she couldn't. Try to give them choices, but not overwhelming them with choices. When somebody has Alzheimer's, especially by middle stage, late middle stage, this isn't a person that you open up the closet and there's 25 hangers there. They might stay there for 4 hours trying to figure out what to wear. It's overwhelming to them. They can't decide. They'll start to reach for something and then they'll pull back and they'll stare. And then they'll start to, no. So you have to diminish their choices to the point where, do you like this or this? And then eventually the day will come where you say, I love you in this shirt, or I love you in this blouse or this outfit. Would you wear it for me today? Because boy, it just makes your eye colors pop. So choices become a detriment. So you have to match what you're expecting of them to their capabilities. And all of that decreases as they go through this journey. Connect in the moment, and that means going into their reality, not yours, but theirs. If you want to connect, It's the only way you can do it. Limit distractions. If you're going to have a conversation, turn off the TV. Go to a quiet area. If somebody's cutting the grass and the window's open, shut the window. Every little distraction will pull their attention away from what you want to do with them. Get rid of extra noise, visual distractions, one-on-one conversations. I spoke earlier that they need to be socializing all the time, but in smaller groups. You know, not large groups necessarily, but small groups. Instead of 20 people, maybe 4 or 5 or 3 or 4. And then eventually it will be one-on-one as the journey continues. TV and so forth, and definitely, of course, phones. Use nonverbal communication. We talked about the nonverbals, your body language, your facial expressions, so important. That's how you're talking to them. They're not getting much of the words you're saying on this as this journey progresses, but they are picking up on your nonverbals. Eye contact, I said earlier, eyeball to eyeball. Gentle physical contact. As they lose the ability to take in their surrounding world and they start to really go into their own reality, and as words really have become pretty meaningless to them, touch is the way you communicate to them. Touch becomes so important. Holding hands. If you sit next to them, shoulder, arm to arm, shoulder to shoulder, so they can feel you right there, that tactile stimulation. Rubbing their shoulder, giving hugs. That's how you communicate that they're not alone, that you are with them. Because as I said, words lose their meaning. But tactile touch becomes a means of communicating with them. Eye contact, gentle physical contact, touch, sight, sound. As I said, smell. They love chocolate chip cookies. Bring in fresh baked chocolate chip cookies they can smell. Bring in flowers if they love used to love gardening or being out. If they used to cut the grass and loved cutting the grass, making those straight lines like a lot of people do, cutting the grass over the years. When spring comes and those first couple cuts of the grass, get them out sitting so they can smell that fresh grass that has such a strong aroma. Get them a part of using the other senses that makes them know they're not alone, that they are still connecting with the world in different ways, but still doing it. Taste, if they love ice cream or something. The only thing with taste is, as this journey progresses, you have to be sure about what they can take in, because swallowing oftentimes becomes a problem, especially near the end of life. And so are they able to swallow? Are they able to only take in pureed foods? Ice cream is pretty easy, a pudding, applesauce, something easy to get down. We often think that thin liquids are what you need, are easier to swallow than like bringing them a milkshake, but it's the exact opposite. Thickened liquids are easier to swallow than thin liquids. So you don't want to give them sips of water. It's better to give them a sip of a milkshake. So thicken things. We don't realize, because we do it all the time, how complicated the swallowing process is, how many muscles, tendons, everything that you use and coordinate just to swallow. But it is very complicated, and it becomes a problem with Alzheimer's, a lot of Alzheimer's patients near the end. So be careful of what they can and can't do. So putting into practice, kind of, what would you do? Alonzo's wife, Alicia, is living with Alzheimer's disease, no longer able to get out of bed on her own prior to her diagnosis. She worked as an elementary at an elementary school as a librarian. Alicia no longer able to speak, and Alonzo is having a hard time communicating with her. This is making Alonzo feel less connected to Alicia. So what could Alonzo do to try to communicate with Alicia and stay connected to her? You want to stay connected to your loved ones as long as possible, always. And there are ways to do it if you know how. So what are the 2 best tips out of these 4? Hold, all right, somebody already has read them. 1 and 3, she says. All right, let's see. Hold Alicia's hand as he tells her what he did that day. Put the radio on in Alicia's room. Not so great. Read one of Alicia's favorite books to her. Sounds good. She was a librarian, for heaven's sakes. There is nothing he can do because she can no longer speak. Well, of course, you are absolutely correct. It is 1 and 3 that you would want to do to help Alonzo taking care of Alicia. And let me get, oh, why I lose these things. Oop. Don't know why. And so Alonzo should not put the radio on in Alicia's room instead of talking to her. It's important to communicate. The radio is not communicating to her. She'll tune it out. Or assume that there's nothing he can do because she can no longer speak. Absolutely, you can connect with your loved ones right up to the last breath. I was a CCU nurse for years. You keep talking to them, you keep touch going till the last breath. We know that hearing is one of the last things to go when somebody is passing away, so you keep talking to them even though they can't communicate back, and you use touch. There are still ways for them to connect and communicate, as we have shown. Communicating with others is important as well. You know, it's important for you if you are in a caregiving situation, it's important for you to have somebody you can talk to. Support groups are great. It lets you talk to people who are going through the same thing you are going through. No one is going to judge you. If you think that, oh, I'm the only one who thinks these things or feels this way, you're not. You're a human being. Everyone goes through the same feelings and thoughts that you have. So it's very important to be able to talk about this, that you have friends and families, and be able to have the difficult conversations that you need. Super important also for you to stay connected and socialize. If you are a caregiver, you need to, what I call, recharge yourself. And that means getting out from under the stress of the caregiving role and recharging yourself by doing something that recharges you, that is fun for you. And what would be fun for me may not be fun for you, and vice versa. So you have to find what works for you and be able to recharge yourself so you're ready to go on with the caregiving situation, the caregiving role. It is very stressful. You will always be your loved one's advocate, whether they live with you, are in assisted living, are in memory care. You will always remain their advocate. You are their primary caregiver. And so, as I said, you are still doing and feeling a lot of the stress. And to be able to watch your loved one fade away and not to be able to do one thing to stop it or slow it down or do anything to make it better, or, stop that progression, it's hard. It wears on your heart and your brain. It wears on you mentally, emotionally, spiritually, and physically, all ways. So taking care of yourself becomes super important so that you can continue to be there for them. You've got to take care of yourself, and that should not involve any guilt whatsoever, because you're doing it for them. If you don't care for yourselves, as I said, I've been doing this for decades. I've seen many caregivers pass away before their loved ones. And oftentimes it's because of the stress. They neglect doctor's appointments. They neglect pain that they might be having. Oh, it'll go away. I'll deal with it next month. I'll deal with it in the fall. I got to get through the summer first. All of these excuses, they put it off, put it off, put it off. And by the time they get to a doctor, maybe the diagnosis is quite serious. As if they had kept up with their appointments, they could have turned things around possibly a little bit easier. Make sure that you communicate with healthcare professionals. If you have questions, ask. We do, electronics can be great. There's a lot of problems with electronics today, but one of the great things are, you can send off questions to your healthcare provider, to your loved one's doctor, and get them answered. Just by, if you have a laptop, you can send things off on your smartphone. You can write, my charts and all those things are wonderful for asking questions. And never think that your question isn't important. If you want an answer, it's important to you. And it's important to your loved one that you have peace of mind that your question is answered, so you are better able to love and care for them. So don't think any question is not important. Prepare for appointments, explain the details. If there's something that you need to talk to the doctor about or you want the doctor aware of, send them a note before the appointment. I have caregivers who drop off things at the doctor's office a few days before the appointment because they don't want to be able to bring it up in front of their loved one, but yet they want the doctor to be aware of what's going on and what life is really like. And so there's ways of communicating and not talking in front of the person as they're sitting there. Take notes or ask the doctor if you can record. And this goes for anyone. If you go for your yearly checkup, ask the doctor if you can record the conversation. Because oftentimes you'll get home and your daughter or your son or somebody will say, well, what did they say? Well, they said something about, something about my cholesterol. I can't really remember exactly what it was. Oftentimes the doctors will let you record the conversation so that if a family member can't go with you, I'm a nurse, but as a senior now, if I go to a doctor, I make sure my daughter goes with me just to make sure that we do pick up, even though I'm well aware of what he says and I'm able to interpret the lab results before he does or she does. I can do that. But yet it's still good to have somebody else's ears there listening. Because sometimes if they say something, you get hung up on it and you miss a little bit of the extra that they're saying. So ask them. I have a son out in Denver. He's all by himself out there. And it's like he had some back issues, skiing or snowboarding too much. And, it's like, he asked the doctor, can I record it? Because my mom keeps asking me all these questions. And so, he did, and the doctor didn't care, and I could figure out what the doctor was really saying and then explain to my son exactly what the doctor was saying to him. So it does make a difference, and it's so use that modern technology. And of course, think about your environment and what's good and what's safe. Safety becomes paramount, especially as seniors and getting up in age, it becomes paramount. And it's very important for somebody with Alzheimer's because they can't understand danger. They can't understand when something isn't safe anymore. So you have to be their eyes and ears and so forth. So that kind of wraps up the communication module for the empowered caregiver. Remember that the Alzheimer's Association has lots of support groups in the area. They have a lot of educational talks. You know, it's really good that Friendship Village brings in speakers to talk on this and help you understand this very perplexing. I kind of look at Alzheimer's as a very perplexing puzzle that has not yet been put totally together because there's still so much we don't know about it. We know a lot more than when I started in '89, a lot more. We were only accurate about 35 to 40% of the time in our diagnoses back in '89. 2026, we're 95 to 99% accurate in our diagnoses. So we've come a long way, but we still don't have a cause, and therefore we don't have a cure. And so there is still a long way to go. But the Alzheimer's Association is a wealth of knowledge. Get on the computer if you have one to be able to read about it. The more you understand this disease and its journey, the better off you're going to be and the better off your loved one's going to be. Because people, you know, friends say, oh yeah, I understand. I was a caregiver. My husband had cancer. My husband had, COPD. My husband had heart failure. It's nothing like Alzheimer's disease. I've been through it in family members. I'm a widow. I've been through, family members. I've been through it all, just about every type of disease. And there is nothing like Alzheimer's disease. So when you talk to somebody who's been on this journey or is on this journey, they understand exactly what you're doing and what you need and the education you need and the resources you need. And so speak up and get educated and get help and reach out for clergy, therapists, good friends that you can talk to and be honest with and let some of this stress that builds up in you as a human being, let it out so that you can be healthier as you do the caregiving role. Questions on anything, communication or anything on the disease? Alzheimer's, period? Anything you might have? Nothing? Yes.
My wife was diagnosed with vascular dementia, and all of the symptoms that she exhibited appeared to me to be very similar, if not identical, to many of the Alzheimer's. Can you describe the difference between the two?
Absolutely, because basically my mom had vascular dementia and not Alzheimer's. But by the end, I kind of think she had what we call mixed dementia. Oftentimes people start out with one. My mom was first diagnosed with vascular dementia. And then by the end of her journey, I would say she had what we call mixed dementia, which is more than one. She had vascular and she had Alzheimer's. There are, Alzheimer's is just one cognitive deficit disease. The most common, 60 to 80% of people with cognitive deficits have Alzheimer's disease. The second most common is vascular dementia. We have Lewy body. We have frontal temporal, which you're hearing a lot more about. We have Parkinsonian dementia. We have an alcoholism dementia. We have lots of different types of dementias, Alzheimer's being the most common. The journey is a little bit different based on what diagnosis you have, but there are commonalities. That's why we can talk about communication for all those types, whether they have Lewy body, Parkinsonian, frontal temporal. We can talk about how do you communicate with somebody who has cognitive deficits. With vascular dementia, the difference is going to be, with Alzheimer's, I say at diagnosis, you're kind of at the top of the mountain with the diagnosis, and then you're going to have a gradual descent as the journey continues. You never seem to plateau, you never seem to get better. It's just a gradual descent. It could be, as I said at the beginning, 3-4 years. It could be 25-30 years to the end. No one goes through it identically. Some very quickly, some very slow. We don't know why. Vascular dementia, they're going to have, what vascular dementia is they have strokes in their brain. These are not the big strokes that we think of that, oh, so-and-so in the apartment 2 doors down had a stroke where their left side's flaccid, their left side of their face is drooping. It's not that type of stroke. They're small strokes in their brain. And depending where the stroke occurs, it will impede their ability to do something based on, is it the part of the brain that deals with vision? Is it a part that deals with talk? Will they become a phasic? Is it dealing with logic and thinking and so forth? Where in the brain have the strokes occurred? My mom really only had about 2 or 3 real big, not big, but strokes. First time she said that she couldn't walk anymore. Well, an hour ago she could walk, now she can't walk. There was nothing wrong with her legs, there was nothing wrong with her muscles. She never walked again. Because the stroke occurred, she didn't think she could walk. The other big one was at the end of her life, she thought she couldn't swallow. And she never swallowed again, food or water. And we chose to let her go. We didn't put a feeding tube in, we didn't go that route. Quality of life was such at that point that why would we keep her going? Alzheimer's Association supports that. Feeding tubes, as a nurse, I know the problems that come with feeding tubes. It's not the best situation for most people. So why put her through that with the quality of life she was at? So, other people could have 3 or 4 or 5 or 6 strokes. My mom had 2 big ones, maybe another smaller one where she lost some ability. But meanwhile, in between those strokes, she really did pretty well. She kind of plateaued. She didn't keep going downhill, like Alzheimer's would. And sometimes I think she almost started to get maybe a little bit better until she stroked again. And so that's the difference between vascular dementia and Alzheimer's, is that journey. It's more a sudden drop. 1 minute they can do it, the next minute they can't. That's not Alzheimer's. Alzheimer's is very gradual. In fact, with Alzheimer's, I had a caregiver Wednesday morning in a support group. It's a men's support group. And the man was saying, I'm with my wife 24/7. He says, I hardly notice any differences. But then you have to look back, well, how was she this Christmas? How was she a year ago? You have to look back 6 months, a year, because sometimes the changes
or multiple years.
are absolutely, they're so small, a change. And, in the beginning, even after diagnosis, so many, I can remember with my mom, friends saying, she looks great. She's the same as she always is. They look at me like, what's wrong with you? You think she has, why do you say she has this? She's great. I can remember my brother when I was trying to tell him, he was down in Cincinnati, I was up in Cleveland, trying to convince my husband and my brother that mom's starting this disease. I know she is. And trying to convince my brother, I talked to her last night, she was fine. I said, how long did you talk to her? Oh, 20 minutes, half hour. She was great, like she always is. I said, come up for the weekend. Come up and stay a weekend and see how you feel. they can hold it together really well for a long period of time, for short periods, a long time, month and sometimes even years, but short periods, they can hold it together. But a whole weekend, go on I've had family members who, oh yeah, we went, down to the shore on the East Coast for a week with the family. All of a sudden, all my sons and daughters are saying, Mom, we didn't know how Dad was, or we didn't know, Dad, how Mom is today. Wow. When they spend a week with the person, all of a sudden, they can't hold it together for a week. And so things start to show up. And as I said, that's the disease. So vascular, you will get those drops, sudden drops. If you have somebody with Alzheimer's and there's a sudden change, this morning they could dress, tomorrow morning they can't dress at all, that's a red flag. Something's going on. It's usually a UTI, upper respiratory infection, the flu. Something's happening. Usually it's an infection, but it could be something more serious than that. Not that an infection isn't serious. It needs to be treated, but it's not life-threatening usually unless you ignore it. A red flag, sudden changes with Alzheimer's, red flags. You got to look into what's causing that sudden change because it's a gradual. Vascular, no, they can be real drops. Like my mom couldn't walk. It's like, what do you mean you can't walk? You just walked up and down the hall, an hour ago, and now you can't walk? So as I said, quite a change with that. Any other questions? Yes.
Tell me about Lewy body disease.
Yeah, Lewy body is a whole kind of different ballgame with Lewy body. They actually have support groups just for Lewy body caregivers. The journey's a little bit different, and the symptoms are a little bit different. You see a little less, sometimes with some individuals, not always. You see more personality changes than confusion sometimes with them, early stage, even into early middle stage. It's a different course with Lewy body. And it's usually a shorter period of time. Lewy body usually doesn't go on for years and years and years. The disease is for most people, is a little bit a shorter. They go through the journey a little faster. And as I said, because there's differences, a little more outstanding differences than Alzheimer's, as I said, they actually have support groups just for Lewy body caregivers. So it is, as I said, it's a little bit different for them. As I said, the commonalities aren't quite the same. They eventually will get to the commonalities, but the order in which they come is a little bit different. Like oftentimes it's memory loss, they forget a doctor's appointment, they, send out a check, they forget to sign it, or they're gonna mail something, they don't put a stamp on it. They're little things, but with the, Lewy body, you see more, as I said, differences, not so much with memory, but some of the other areas. It's a little bit different. It's probably the one that's a little bit more unique than the other types.
Any other questions? No?
Yeah. It's a type of, it's just like Alzheimer's, and it's not just like, but it affects the neurons in the brain, but a little bit different. The way the brain cells are destroyed, they're shaped differently as they're being destroyed. It's just a little more unique disease, and as I said, there are commonalities, but there are differences enough that, as I said, they actually have different support groups. It's a little harder road for the caregivers. I hate to say that, but it is. It's tough. Lewy body is a little tough. If you think Alzheimer's is tough, Lewy body is tough. It's a tough disease. Very much so.
Thank you all so much for joining us.
Okay.
Thank you, Rose.
You're welcome.
We will be back together next month, the first Thursday of the month. If you look on Touchtown or if you look in the Villager or in our newsletters coming out, there'll be a little flyer with the QR code that you can sign up for there. Next month's presentation is on behaviors. So it's talking about behavior changes and, what do I do about them and some different techniques for that. So we would love to see you there. Thanks very much again. Have a good night.
Yeah, please sign in. If you haven't signed in, do sign in the back. Thank you.